Good day everyone, I am Alnis Mantua, the first presenter. Today we will discuss physical disability. So what is physical disability? A physical disability is a physical condition that limits a person's ability to function and perform activities ranging from moving to communicating to taking care of themselves. If a condition, illness, or injury has a significant impact on a person's ability to move, communicate, or care for themselves, it may be considered a physical disability. There are many types of physical disabilities. Some affect a person's ability to walk, lift objects, or perform other gross motor tasks. Some impede a person's ability to use their senses through sight, hearing, or touch. Other physical disabilities impair a person's ability to communicate or take care of themselves. So, what causes a physical disability? Various causes of physical disabilities affect a person's daily life differently. Physical disabilities may result from perinatal, acquired, or congenital factors. First is congenital disability. People within the group of congenital physical disabilities, also known as hereditary, have had a condition since birth, which may include impairments that already have occurred while the baby was in the womb. Also, inherited genetic issues, injury during birth, or issues with muscle cells can develop this condition. The second is acquired injury. A person may develop a physical disability for a variety of causes. This can result from severe accidents, brain injuries, infections, diseases, and other conditions like dementia and a stroke. And the last one is perinatal causes. The period just before and following childbirth is known as the perinatal period. These era's disabilities are primarily biological in nature. They may be brought on by preterm delivery, severe trauma, oxygen deprivation, or an infection picked up while being delivered through the birth canal.
Good afternoon everyone. I am Alisa Amarili Paronda and I will be discussing the types of physical disability. So first is the musculoskeletal disability, second is the neuromusculoskeletal disability, and third is the sensory impairment. So first is the musculoskeletal disability, which is the bones, muscles, and joints are all affected by this type of disability. It may result in limb loss or deformity, muscle weakness, and osteogenesis imperfecta, which causes brittle bones. Musculoskeletal health refers to the performance of locomotor system comprising intact muscles, bones, joints, and adjacent connective tissue. Musculoskeletal impairments comprise more than 150 different diseases or conditions that has affect the system that are characterized by the impairment in the muscles, bones, joints, and adjacent connectivity tissues, leading to temporary or lifelong limitation in functioning and participation. Second is the neuromusculoskeletal disability. The neuromusculoskeletal condition makes the person unable to move the body parts affected and can also lead to nervous system disorder or degeneration. Neuromusculoskeletal disorder are conditions that affects skeletal muscles, peripheral nerves, or neuromuscular junction. Third is the sensory impairment. Visual and hearing impairments fall under the category of sensory impairment. Once more, people may have experienced sensory impairments throughout their lives or may have grown blind or deaf in later life.
Good afternoon everyone. I am Ivor B. Brasa and now let's proceed to the next topic, which is the common physical disabilities. There are 7 common disabilities: cerebral palsy, acquired brain injury, spinal cord injury, spina bifida, multiple sclerosis, epilepsy, and arthritis. Cerebral palsy, a group of non-progressive disorders occurring in young children in which damage of the brain causes impairment of motor function. These events can happen before, during, or shortly after birth or in the few years of life when the brain is still developing. An acquired brain injury is a brain damage caused by events after birth rather than as part of a genetic congenital disorder, such as fatal alcohol syndrome, perinatal illness, or perinatal hypoxia. The lack of oxygen to an unborn child during labor and delivery occurs at sign of certain complications during labor and/or delivery are not caught in time by medical staff. Spinal cord injury, or SCI, is a damage to the bundle of nerves and nerve fibers that sends and receives signals from the brain. The spinal cord extends from the lower part of the brain down through the lower back. Spina bifida is due to the development defect of the spinal canal, characterized by incomplete closure of the bony encasement of the spinal cord. It may cause paralysis of the lower part of the body, depending on the level and extent of the lesion. The person may lose bowel and bladder control and may have sensory loss at the affected site. This person may require a pair of crutches or wheelchair to move around. Spina bifida is a condition that affects the spine and is usually apparent at birth.
So for the continuation, I am Angel Lozada. So next is multiple sclerosis. It's a condition that can affect the brain and spinal cord, causing a wide range of potential symptoms, including problems of vision, arms or leg movements, sensation, or balance. It is a lifelong condition that can sometimes cause serious disability, although it can occasionally be mild. So next one is arthritis. It's the swelling and tenderness of one or more joints. The main symptoms of arthritis are joint pain and stiffness, which typically worsen with age. The most common types of arthritis are osteoarthritis and rheumatoid arthritis. Then next is epilepsy. It's a disorder of the brain characterized by repeated seizures. A seizure is usually defined as a sudden alteration of behavior due to a temporary change in the electrical functioning of the brain. So, how can epilepsy affect a child's ability to learn? So, seizures can be disruptive and cause memory problems. Medications and side effects can also impact learning, and missed school days can make it hard for the child to keep up. So support and accommodations are important, very important for a child with epilepsy to succeed in school. So, next is treatment and support for people with physical disabilities. Living with a physical disability or motor movement can be challenging. To keep independence and live well in the community, several disability support plans need to be placed. The physical disability severity will define the type of care you require. Some people may need to see their primary care physician or a specialist. So in contrast, others may need a team of medical experts to handle various aspects of their care, such as physical, occupational, and speech therapists.